population. And that's the only thing I can come up with so far. I mean, I ain't even done. That's that work. Downstairs with my horse. You park your horse? Yeah. Out in the alley. Keith, practice. He's got blue ones, so we got to trim some. I'm going to bring Leon up here just in case. Yes, we got to talk. Oh. That's one of my heroes. Take a look. Oh, you found it. She's ready. Okay. Good Friday, slightly afternoon. Emergency response. I entertain a motion to reconvene. So moved.
Second.
All right, a roll call. Mr. Matthews,
Aye.
Mr. Blau,
Aye.
who is representing District 2 today? Is Mr. Dodson or Mr. Taylor with us today? Okay, hearing none. Mr. Davidson? And Lauren says aye. We are again in session. Entertain a motion to reopen item number 3, discussion review possible action regarding presentation from emergency management.
Second.
Motion is second. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Davidson? Aye. And Lawrence is an aye. My report for today, slightly different, not much, but slightly different because the state has changed the formatting of their reporting, but still most of the same basic information and then a whole bunch of other things that we won't do. But stay at home, again, greatly reduces your chances of exposure and your chances of exposing others. Persistence and preventative measures is more important now than ever. As some of you probably saw, Mr. Trump yesterday rolled out a 3-phase reopening strategy with the doctors that are on his COVID-19 task force. We'll have more information on that coming. I'm not going to get off into the details of that necessarily today. We are still under presidential disaster declaration, includes all of it. And as stated days ago, approving 100% federal share reimbursement for the National Guard on that side of the states. Declaration and a catastrophic public health emergency. This includes public assistance, emergency protection measures, federal assistance for state and local governments responding to the COVID-19 emergency. And Oklahoma County appears to be eligible for the CARES Act stimulus funding. It's my understanding that is on the agenda for a special VOCC meeting this afternoon. And this is not disaster declaration related funding. This is a different funding stream. Excuse me. Updated numbers for Oklahoma. We are at 2,465 positive test results, which is up 108 from yesterday. And we now have 136 fatalities, which is up 5 from yesterday. And the largest numbers continue in Oklahoma County, Tulsa County, and Cleveland County. We have had now 84 seasonal flu deaths since September 1st. That's one additional this week. There are 1,331 Oklahomans who have recovered from COVID-19 of the known ill who were diagnosed specifically with COVID-19. Again, 1,331 who have recovered. We have seen 31,155 negative test results, and that does not include private labs. 528 cumulative hospitalizations. The average age on those hospitalizations is 65.2. And there are still now 87 drive-through test sites in operation around the state, and the hours of operation and prerequisite requirements vary. So looking at the State Department of Health website will provide additional information there. Oklahoma City County Health Department test site is still a non-medical referral site, meaning they will schedule appointments for those who go through the triage line and meet the testing guidelines. As I stated, we're under a gubernatorial catastrophic public health emergency, and there's going to be additional re-entry information at the state level anticipated quite soon, likely today or tomorrow. That will be in alignment with information from President Trump's COVID-19 task force information provided yesterday. If you saw that, much of that is being deferred down to the state level, and it's got everything to do with the statistics in your state, in your area, in your region, and what the governor plans to do with that particular situation in the various states. Public safety answering points or 911 centers are still receiving positive case addresses to provide to responding first responders, if in fact they have an address that matches where a positive case was identified. Projected peak for Oklahoma is now anticipated to be April 30th. We have not, and as my statistics a while ago indicated, we're at 108 positive and up 5 fatalities from just yesterday. U.S. peak is projected this week, and the U.S. peak resource list continues to decline. So overall, nationwide, we're seeing a bit of declination, but we still, in Oklahoma, have yet to reach our peak. These are statistics provided through the Institute for Health Metrics and Evaluation, and it does include full social distancing through the end of May. We've talked about Department of Public Safety in Oklahoma suspending face-to-face services. Some licensure and handicap parking permit expirations have been extended. Some online license renewals of licenses online are available. Would again mention severe weather sheltering. We're not anticipating any severe weather in our area in the next few days. However, maintain social distancing if sheltering for severe weather, and make your plan early, not waiting until impending severe weather conditions develop. In Oklahoma County, we're looking at 483 positive test results, 22 fatalities, and as of the 16th, we had 2,905 tests completed at the drive-through site in Oklahoma County with 147 positive there. 18 positive cases still being reported at Tinker Air Force Base, and they have restricted visitor guidance in place and revisions of available gates. Hotline information for those with questions. The City County Health Department hotline is 425-4489, and the state hotline is 877-215-8336. Some more local Oklahoma County information, and thank you to Christy Jernigan Marshall for providing me some updates and very interesting and good information. Organization called Helping Hands, which is a small healthcare provider for the homeless under the Mary Mahoney Memorial Healthcare Organization, is stepping up to oversee testing process for the shelters, and that is to help ensure that they're properly performing those tests and that follow-up is provided for the folks that are involved there should it be needed. There are apparently multiple telehealth providers, both physical and mental health providers, coordinating their efforts, and need a more concerted effort there. And apparently they're beginning to use nursing students who are needing training hours to incorporate into this, obviously with the proper supervision. Alternative care homeless shelters. Those activities continue to involve the Homeless Alliance and Oklahoma County Social Services under Chrissy's guidance, and several other partners, and they're still working through agreements and contractual issues. The City County Health Department has tentatively provided a path for supporting those shelter efforts, with again Christy working through details of that and engaged in those discussions of various activities. Grace Rescue Mission in Oklahoma City is relooking at life safety codes issues. The fire marshal has been contacted and had to weigh in there. They are transitioning because of the change in the way they're doing business and what kind of services they're providing. They basically are transitioning from an assembly occupancy to a residential occupancy, and that brings on substantial differences in codes. And the Oklahoma City fire marshal is a friend of mine, and I know that he would definitely exercise prudent judgment in regards to the things there, and they can incorporate different measures to assist with that situation, but there may have to be some adjustments made there. The Alternative Care Site Initiative, which is not the same as the Homeless Alternative Care, that is, again, Oklahoma Hospital Association working in concert with the Oklahoma National Guard, and the Guard in that aspect is in a medical support role only. Additional facilities have been discussed. The universities we've talked about on several occasions. Now appears that the use of OU and OSU dormitories for housing for positive cases is likely going to be taken off the table, citing a lack of need. Apparently, there is not a need-driven issue there, so they're pulling that away. And Christie has advised the City County Health Department approved $100,000 of additional funding at their board meeting yesterday. I'm not sure of specific directions for those funds, but additional money apparently has been appropriated. Personal protective equipment, still a concern for first responders. Some slides continue to come in. The Oklahoma County Emergency Management point of distribution that we're operating and have operated for several weeks now. We received a significant shipment yesterday and worked into the evening hours last night with our full staff and several of our volunteers. We now have 4 deliveries and distributions to multiple entities, multiple jurisdictions, including additional counties and a tribal entity in the central part of the state. And we also have OBU, UCO, and Oklahoma County Jail and Juvenile Justice are also part of our distribution efforts. I'll be giving you a total count of items that we have handled and processed through there when we get closer to the end of the situation. It will easily be in the hundreds of thousands, if not more, of items that are going through the emergency management point of distribution. Oklahoma city government's apparently still taking through, I believe, the 17th applications for small businesses within Oklahoma city limits to apply for disaster relief, not related to the presidential declaration funding. That is something that Oklahoma City is doing internally. And the City County Health Department is still requesting donations of various basic items. If you're interested or have the capability to assist with donations, we recommend you contact City County Health Department, and additional information is available on their website. Internal Oklahoma County government, we continue to emphasize ReadyOp for information purposes. Our declaration that was approved March 25th is still in place. And the Oklahoma County Court Clerk marriage license is still requesting people to bring paperwork already prepared and to make an appointment before they come in. The count through the door yesterday reached a peak. I believe this is the highest number we've seen since we've implemented limited access. We had over 120 people coming through the door yesterday. And in talking with the deputies who are working security downstairs, they said VPOs are extremely busy, continues to be a peak issue. In fact, I think there were 4 or 5 people working on VPO paperwork when I came through there just a few minutes. And we had roughly 30 inmates shuttled yesterday as well. I provided some draft reentry information to the committee members a couple of days ago. That is going to be revised. I'm going to be including information from the presidential information yesterday, and then as we see from Governor Stitt and City County Health and State Health Department information continue to become available, I'll be implementing that, including that in that reentry information. Those will remain drafts, and we can continue discussion as necessary at the meetings or wherever before we roll any of that out. But that reentry information is coming. Notable, Oklahoma Medical Reserve Corps is still soliciting medical and non-medical volunteers. Go to the okmrc.org website for additional information. Warning signs and symptoms continue to remain consistent: trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse or awaken, bluish liquid face, persistent fever. Personal protective measures remain consistent, and I would stress this again, particularly with the reentry discussions that are going on in a lot of places. Reentry will be very heavily dependent upon statistical analysis and various pieces of information that are being gathered through monitoring, not only through the healthcare providers, but in the general community. And personal protective measures remain quite important. That's frequent hand washing, covering the cough or sneeze, social distancing, stay home unless absolutely necessary to make an essential trip, and recommendation to open packages outside of the home or work area and leave shipping materials outside. The American Red Cross and Oklahoma Blood Institute still continues to request blood donors, although I did see yesterday in one of the conference calls I was involved in, our local rep at the American Red Cross had mentioned that they are receiving a fairly good number of blood donors through the Red Cross. I do not know about OBI, but she was quite appreciative of that and expressed it. Should they be able to continue, that people who can donate, please do so. Again, the false information, particularly now with the reentry discussions going on, continues to be heightened sensitivity to reentry. And I would again emphasize that that's going to be based on several key factors: availability of information, tracking cases, and various investigative situations, able to keep statistical information. And we must see a continual decline in the numbers of cases and fatalities before things are generally going to open up in any broad sense. And as I stated earlier, those numbers continue to go up as opposed to down. So my encouragement is for people to exercise patience, continue to exercise protective measures, and see if we can't, as they say, flatten that curve, which has not occurred as of yet in Oklahoma. And I believe that concludes my report, with the exception of any questions or discussion.
Seeing no questions, motion to receive report.
Thank you. Got a motion received. I hear a second.
Second.
Got a motion and a second. And roll call, Mr. Matthews,
Aye.
Mr. Blau,
Aye.
Mr. Davidson,
Aye.
and Barnes is an aye. Motion approved.
Mr. Chairman, just for
Sir.
your information, I guess Mr. Dodson's trying to dial in, but having difficulties.
Okay.
Eventually, he may be working on.
Okay. We'll watch for him popping up on the screen. Certainly include him when we get him involved. Any presentations or information from BOCC departments? Anybody receive notes or any information to update from BOCC?
I got new numbers from Grant Billingsley.
We need to reopen that.
Yeah, motion to re-enter.
Got a motion
Re-enter item
to
4.
reopen item number 4. Do I hear a second?
Second.
Motion second to reopen item number 4. Mr. Matthews,
Aye.
Mr. Blau,
Aye.
Mr. Davidson,
Aye.
Barnes is an aye. Go right ahead, sir.
First I'll note the new system over in the ICB building seems to be working well. So I appreciate everybody's help with that and protecting our employees and those that are coming to get drug tests. Wednesday, I think we reported yesterday, we had 1,213 county, 246 DOC, and 0 municipal, which is good. Today's our count is 1,217 county, 247 DOC, and 1 municipal. DOC has somewhat seemed to have leveled off. We're not going up in large chunks anymore. It seems to be like 1 or 2 a day, if that. We currently have the ability to keep those housed. Avenues have been explored. It's just finding a facility right now that has the ability to put 250 people in it is difficult at best. Some of the people that we've talked to, including private prisons, if we were to put 250 people in there, it would be very, very expensive. And with the DOC reimbursement rate, we've gone down the route with AD's office and the attorneys at DOC. It does not look like, even though we contract at a special rate, that we would be able to be eligible for anything more than $27 a day. So I don't know. What's that?
I have a question for you, and
Yeah.
I think we're all in agreement. If we can lower the DOC population somehow, that's beneficial. In these discussions that are ongoing, have we discussed the authority of the county to transfer inmates who are now under DOC's control?
Yeah, my understanding is we actually have to be at a certain population rate for what we are deemed able to hold by the state health department.
Is it the health department or the fire marshal?
Health department is what certifies our, or is what would trigger this statute, from my understanding. And that's 2180, I believe.
Yeah, that number's probably the same as the fire marshal then. Okay.
Yeah.
All right. Well, so you guys are looking at the ability of the county to.
Yeah, unfortunately, we'd have to meet that threshold, and we certainly don't want to meet the threshold again.
Right.
So I don't think that, I mean, we can't trigger that, hey, you've got X amount of days to come pick up your people, that part of the statute, unfortunately. But my hope
Right.
was doing something to get rid of these individuals out of our jail. And my biggest concern is, you know, if we did have an outbreak in there, we would be responsible medically for their costs if something were to happen to them for the immediate. I mean, I think we get reimbursed if they're DOC, but then we'd have to go through all that stuff.
So while we have some restrictions on the ability to move these folks out to, say, a private prison setting, there's nothing that prohibits DOC at this time from doing that, is there? I mean, I understand they're not wanting to bring people into the state-run facilities, but
Right.
there's nothing that I assume prevents them from contracting with private prisons. They've had a history of doing that.
They have.
Are you aware if that's an avenue
Yeah.
they're exploring?
Sorry, go ahead.
I was just curious if you were aware if the state were exploring that avenue to provide some relief to the counties without adding additional people into the state beds.
So the issue there is just as it would be for us, it's cost. The facilities that they could ramp up quickly, the population to place inside those facilities isn't great enough to keep the cost low. So if we were to say put our 250, Tulsa I think has like 110 or so. You know, just at 360, the two facilities that we've looked at that are currently vacant, it would fill up like one wing of a facility, and they would have to fully outfit one of those facilities, and it would crank the per day cost rate up to a cost that we would not be willing to pay, or the DOC would be willing to pay. It'd be twice what the judicial rate that was just established here in Oklahoma County is. So it's just not a feasible thing for them, for us, as it sits right now. But I can tell you that Mr. Williams is exploring just as many avenues as I am, contacting his DOC. He's been a great help in this as well. So it's not that we've stopped exploring to find a solution to. It's just I don't know what the inside the box thinking probably has been exhausted at this point. So if we've got an outside the box thinking, we had a thought that maybe some of the tribes that operate the private prisons might have bed space for them. They're packed, as you can imagine in this state. One tribe had a dormitory type setting that they're putting together I don't know, you want to call it a proposal or whatever, possibility for housing some of these inmates, but it's nowhere near 250. I mean, we would just be probably putting 50 to 75, maybe even 100 inside of a dormitory. It would obviously cut our population in half with DOC people, but ideally, I think we'd want them all out. There's been some discussion about, you know, can we send them out of state? You probably could, but do we want to? I don't know. I mean, if anybody's got any other ideas that, I mean, this is certainly the place to discuss it and see what we can do. But I think Grants people are working well, and you know, the population being what it is, as long as we can keep them somewhat segregated, and that is the one benefit, I would say, of our building being broken up into the pods and on different levels, is it is easier to segregate. So.
Okay.
I mean, if you got any thoughts, Joe, I'm more than willing to, we can explore them or.
Not off the top of my head. I guess what we're hearing is private prisons are expensive. And my other concern would be that the county, has the ability to move people who have been sentenced to the care of the Department of Corrections to other facilities.
Yeah, and I mean, there's question even about the way the statute is with the 45 days and the JNS sheet, one
Right.
case file, stuff like that. So,
Yep.
you know, with the suspension of some of these statutes and such, I just don't know. You know, they suspended the intake of these individuals and backed them up on the counties, but they didn't really address the county's ability to do something else besides housing them inside their jail. We've had that discussion with some of the governor's staff. You know, we'll look into it kind of things, but as it sits right now, there's not a clear cut solution. But
And
we're
this
still
is,
working. Hopefully something presents it.
and Miles, as you know, I mean, this is really nothing new in terms of how DOC operates. It just happens that at this time we're dealing with a public health issue. But when DOC is at capacity, they were doing the same thing to us. They were backing them up, and we were holding large numbers.
Yeah, my understanding, and speaking with Mr. Williams, is that their current backlog at LARC, or the reception center, is not as high as it usually is. Even so, they haven't reached that level of concern yet within the DOC because of that backlog, I guess, is somewhat lower. But yeah, I mean, if this continues, I would think that at some point we're going to reach their concern level, and we're going to have to come up with something to do with these individuals. So we've got a new DOC director. I mean, there's some hurdles here. So
Yeah, right. Okay, well, I appreciate the update.
Yep.
Any further discussion of that topic? Information from Mr. Bennett.
Now, motion to receive.
Motion to receive the report. I hear a second.
Second.
Motion and second. Roll call. Mr. Matthews.
Aye.
Mr. Wow.
Aye.
See Mr. Dave. Let's see. Yeah, Mr. Dotson has joined us. Mr. Dotson.
Aye.
And Mr. Davis.
Aye.
And Barnes is an aye. Thank you. Item number 5, facilities management. Any updates and information? Item number 6, discussion review possible action regarding presentations from Oklahoma County Clerk, Oklahoma County Court Clerk, Oklahoma County Treasurer, Oklahoma County Sheriff, Oklahoma County Assessor's Office. Anyone have information from those offices or representations to share information? All right, hearing none, action. Item number 6. I believe that takes us to item number 7, discussion of possible action determining next meeting time or date. Our next regular meeting is Monday the 20th at noon. Any further discussion? Any comments from the members? Mr. Matthews?
No comment.
Mr. Blau?
No, thank you.
Mr. Dodson?
No comment.
Mr. Davis?
No, thank you.
I have no comments. I entertain a motion to adjourn.
So moved.
Got a motion. Do I hear a second for adjournment?
Second.
Got a motion and a second. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Dodson?
Aye.
Mr. Davison?
Aye.
Barnes is an aye. We are in adjournment. Thank you.